Greetings. In this video, we will learn about anorectal malformation, which is also known as ARM. So, before we move ahead, we should know what is normal. So, we all know that we ingest food through our mouth, which is digested in our food tract, and ultimately we ingest, that is, we remove the waste products from our body from an opening in our body called anus. So this blue cloud-like thing is the gas and signifies gas, and this is the stool. So once we ingest the food and it gets digested, so it goes through the large intestine and gradually it enters the area of our body just before the opening, that is the anus, that is the rectum, where the stool is stored for some time till we feel comfortable enough to evacuate, and then the stool and the gas is excreted is excreted through the opening called anus. You will also notice this small rounded brown structures on either side of the anus. Now these are the special muscle fibers that we also call as sphincters, which surround the opening, just proximal to the opening, just before the opening. They encircle the whole tube and give us some control over the opening and closing of this tube, and therefore we are able to control the timing of our evacuation. So this is the rectum and this is the anus, and any problem do, in the development of these structures is called anorectal malformation. Now this is a line diagram of a perineum of a female, and this is the female genital organ, in which this is the vagina and this is the urethra through which the urine is passed, and this red circular opening is the anus. Similarly, in males, this is the male genital organ, and this red round structure is the anus. So, in both males and females, this anus is of a particular caliber that we consider normal and is located at a distance, fixed distance from the genital organs to be considered as normal. So the location of the anus can be anterior, like in this case, the anus is more anterior and more towards the genital organs, which has been hidden by this small box here. And this again is a type of anorectal malformation. In few patients, even though the anus is at the normal site, it is considered very small in caliber, and again this is a variety of anorectal malformation. In few cases, there is no anal opening seen in the perineum. That is, the anal opening is absent. So, it is apparent that this malformation occurs while the child is still inside the mother's body. That is, the child is a fetus. So, once the child is born, on examination, the doctor is nearly always able to pick up these abnormalities. But however, if this abnormality is not picked up, the belly of the child may gradually distend, and in such cases, urgent medical care is necessary. The reason for the fullness of the belly is quite apparent once we consider that all the gas and the stools is being produced in the body is not able to get out through the anus, and it will then accumulate inside the intestine and will cause distension of the abdomen. So once a diagnosis of anorectal malformation is made or is suspected, it is important that the child is taken to a facility where a pediatric surgeon is also available and can help in the planning and treatment of the patient. So once the child reaches the hospital, the first step is to stabilize the patient. The child may be having some deficiency of fluids, maybe having some low temperature, body temperature, which needs to be corrected. After that, the Anorectal malformation is assessed for the level and the degree of malformation that is present in the patient. So along with this malformation of the anal opening and the rectum, the baby may also have malformations involving the other organs of the body like heart, and therefore echocardiography may be performed to rule out any malformation in the heart, malformation of the spine and the spinal cord. So X-ray or ultrasound may be performed to rule out any malformation involving this part of the body. And thirdly, the kidneys and related organs may also be affected, for which ultrasound again may be performed to rule out any malformation in the kidneys. So once the baby is stabilized and other malformations have been detected, now for the malformation, it is important for the surgeon to determine that what is the level of these malformations. So if the malformation is below the level of the sphincter or the muscles which gives control over defecation, then we usually call it a low malformation. But if it is located above the level of the sphincters and the pelvic floor, we call it a high malformation. So in a low malformation, if the opening is narrow or it is opening very close to the skin, then simply a single stage procedure, a surgery can be performed in which the anus can be made of normal caliber and the opening is made at the right location. In few cases, the distalmost part of the intestine, that is the rectum, may open quite a distance away from the skin, even above the level of the muscles. In such cases, the bringing down of rectum directly onto the skin in a single procedure is not feasible and may not be safe for the child. In such cases, a stage surgery is performed, and as a first stage, the intestine is brought directly onto the skin, creating an opening in the intestine through which the gas and the stool can come out. So after creation of a colostomy, the baby is discharged from the hospital and the further investigations are performed on an outpatient basis. So one of the investigations which is required in high variety of malformation is a colostomogram, in which we inject a contrast into the colostomy and we try to find the level at which the rectum is ending and how far away it is from the skin, and this is determined using a X-ray. So after the colostogram, we know the level of the rectum and then the surgery can be planned. So during the surgery, the surgeon splits the skin and the muscle fibers in the midline, and then the rectum is pulled down. So this is the result after the surgery. The colostomy is in place and the rectum is pulled down to the skin level, ensuring that it is equal amount of muscle fibers on either side. In few cases, the level of the rectum is too high and cannot be approached from below, that is through the perineum. In such cases, the belly of the child may have to be opened to further mobilize and make this intestine loose enough to be brought down to the level of the skin. So once this procedure is performed, the child again follows up in the outpatient department, where we ensure that through the help of metal dilators, this area that we have created and applied stitches does not decrease in caliber, that is, it does not get stenosed. And once we are sure that this opening is now adequate, the stoma can then be closed, and after that the child can pass stools and gas through the new anal opening that we have created. Now I will talk about the complications of surgery. So every surgical procedure has some complications, although they are rare. So one of the complications that can happen after the surgery is infection. So once we apply stitches, there's a foreign material being inserted, and in some cases there can be infection at the local area. And sometimes when this infection occurs, the stitches become loose, and the rectum that which we have brought down can go back up into the tissues, into deeper into the pelvis. In some cases, like we mentioned, the need for dilatation after the surgery. So if the dilatation is not performed properly, then the opening may again become small, and therefore it is necessary to follow your doctor's advice and to use dilators as directed by your doctor or nurse. So the dilators, once we insert it on a regular basis, it maintains the caliber of the opening and does not allow it to become smaller. Another problem that is seen in few patients is prolapse, in which the part of the rectum may protrude outside the anal opening, which is seen as this reddish pinkish tube which protrudes through the opening. Very mild degree of cases can be managed without treatment, but in significant prolapse is there, significant outward movement of the mucosa is there, then surgery may be indicated. Other problems that can happen in this baby is constipation. We must understand that this is not a normal opening created by the god. This is an opening that is created by a doctor. So it cannot be expected to function exactly like a normal orifice. So there can be some degree of constipation. There can also be soiling and incontinence, which can be because of various reasons. And for the same, you should follow the advice of your doctor. Thank you. I hope this video was able to tell you a little bit about anorectal malformation. Thank you.